Well, good morning and welcome to the Aesthetics Show. We're on live TV right now, and I have the pleasure of having Dr. Sachin Shridharani, a board-certified plastic surgeon on the Upper East Side in Manhattan, Fifth Avenue. As we're going to speak today, we're going to speak about different types of fat reduction. Dr. Shridharani, share with me, if you could, what brings you to the Aesthetics Show?
Well, Jay, thanks so much for having me here. I think the Aesthetics Show is bar none one of the most premier aesthetic meetings. I love the multidisciplinary approach, talking about technology meets surgery. So what brings me here is I'm on a panel shortly, and I'll be giving a talk on my signature treatment for surgery and a syringe for body contouring. So I'm here to learn from my colleagues and to hopefully share some great information.
Good. How many times have you been to the Aesthetics Show before?
It's actually my first time here. So
well, welcome aboard. We're proud to have you as part of our faculty. Okay, so with all of the different weight reductions, body contouring, procedures out there, what is your number one go-to type? Because knowing you are in the Mecca, one of the Meccas between Beverly Hills, Manhattan, Fifth Avenue, what allows you, with all the different types of patient bases that we have, for you to choose the type of procedure that you feel is best with your patients? Because no two patients are alike.
You said the most important thing, which is no two patients are alike. So a big part of our practice is really giving patients an incredible experience. Every new patient consult really revolves around understanding the patient's goals, their expectations, understanding the downtime associated with it. In reconstructive plastic surgery, we talk about the reconstructive ladder, or working our way up to a more aggressive treatment. In aesthetic surgery, I think there's also a very similar aesthetic type of ladder where we can start with non-invasive devices through minimally invasive injections, and then all the way up to the appropriate surgical outcome. Each one has its pros and cons, as we all know, and for me, it's really understanding what that patient says to me and what they expect. If they're expecting a totally contoured, bespoke look, tailored down to the millimeter, a device may be challenging to achieve that. If a patient comes in and says, I'm phobic of surgical procedures and I'll tolerate a nice improvement, a nice modest change, but at the end of the day, like, I can't have something else, we're gonna wanna stick with something that's more device.
Now, as a board-certified plastic surgeon, and I deal with many of them, your number one usual go-tos are surgery. I mean, you became a doctor, you went through general surgery and became a board-certified plastic surgeon. How do you differentiate when a patient comes into you to be able to meet and exceed their expectations by using a non-surgical device when they come to you? And there are so many providers out there that are non-core in this industry today. Most people come to a board-certified plastic surgeon to have plastic surgery. How do you differentiate that from your competition in Fifth Avenue?
Well, again, I think one of the biggest components is I love to spend my day in the OR. I did train to become a surgeon. I love surgery. We have the benefit often that by the time the person comes, the patient comes and is coming to a plastic surgeon, they've already sort of pre-selected that they are likely okay with surgery. Or now and more what we're finding are patients come in and say, I want your expertise as a surgeon of understanding the anatomy, but I'm still opting for something non-surgical. Can you distill down for me what you can achieve without surgery, but applying your clinical acumen? So that's what differentiates us, is a surgical approach to non-surgical modalities as well.
With all the new devices that come out, now I've been in this conference here for 9 years, right? From the inception, from the very beginning. And I see radio frequency, I see cryolipolysis, I see syringe-assisted liposuction. I've seen all different types, and every time I go to a new conference, and I lecture at many of them, I see a new device. How do you, as the clinician, keep on top of all these devices for you to choose which one is best served for your patients?
Data is everything. I'm big on the science and I'm big on the data. So for me, what's really important is I love to see like a systematic review of the literature. I love to see randomized clinical trials, number one, because we take my background at Johns Hopkins for nearly a decade. We distilled everything down from the science and applied the scientific rigor to helping our patients. So we do the same thing in aesthetics also. So I'm gonna look at the data on a new device. I'm going to look at what that science shows. I'm going to look at what my clinical trials will show us, and then I'm going to take that and then extrapolate it to actually helping my patients. But there are a lot of treatments and a lot of devices. You can't have every single one in your practice, otherwise it becomes a graveyard for technology.
Of course.
So you've got to basically say, okay, well, you know what? I'm finding tremendous improvement with cryolipolysis. Now I'm going to help accentuate the muscles by applying some muscle strengthening as well. So I think multimodal approaches are the way of the future. There's no one device that's going to do it all. So we're going to use different technologies to burn the fat and then stimulate muscle to really help the overall ideal aesthetic.
You bring up a very good point, because when you do a surgery, you usually know if you do a tummy tuck, if you do a breast augmentation, you're probably not going to have to do another one for many years to come.
We sure hope not.
Right. With these modalities that come out, and knowing that it's a newer modality that comes out the following year, data says everything. But what do you explain to a patient about the long range effect when many of these machines haven't been out long enough to really do the trial, the sniff test to say, what's my result going to be 3 to 5 years from now, when these machines, some of them have been FDA cleared, but haven't even been out 3 or 4 or 5 years?
So that's a really important question, because we do clinical trials in our practice. We have great partnerships with a lot of the major pharma aesthetic companies and help do these clinical trials and bring treatments to fruition. I think, again, it's very much about transparency, right? So patients need to understand that, listen, this is tried, true, and been around for 10 years, and I've got great data on it. This is a new treatment. It's a new shiny penny. I know you're excited about it. I know you've seen all sorts of great stuff on social media about it, and I know that you're thrilled because what one of your friends underwent. Let me explain something to you, though. You're going to we don't know what this is going to be like at 3, 5, 10 years. We know it's FDA cleared. We know it's gone through the rigors that I can keep you safe, which is the #1 important thing. But if you're talking about longevity, you may not have that. Now the patient is in control and can say, thank you very much, Dr. S. Really appreciate that. I do want to try it because you told me you're going to keep me safe, and I guess I'll deal with it if it doesn't last as long as I was hoping, because I know you also gave me all of my options. Remember, we have the ability, it's the old adage, if you only have a hammer, the whole world is a nail. So if we can offer surgical intervention, which we have tons and tons of data on, if we can offer surgery in a syringe, which we have a tremendous amount of experience with, and if we can also offer devices, it makes us comprehensive, and we're not going to push the agenda of one specific treatment, it's pushing the agenda of getting a patient a specific outcome.
This is great, because with all the devices out there, and with all of your surgical skills, I have an old saying that with 100% of your skill, you may only possibly get a 50% result, because the other 50% lies on the compliance with the patient, right?
Absolutely.
Do you ever speak to the patient about lifestyle change? You can be the best magician as a surgeon and contour their body, but if they don't have a lifestyle change and a commitment to keeping that weight off and the contour of their body, they'll be back to see you again and again, and almost make it seem like all the professional skills that you did for them didn't work.
Well, that is so important, because across the board, what we find is that it's those lifestyle modifications and a comprehensive approach to patient care that makes a huge difference. So when we're, again, doing our intake, when we meet with our patients 2 to 3 times before any surgical procedure, we have gotten to know this patient so well that we're understanding, is this a single acute lifestyle event that led to some weight gain? Is this a chronic condition and they've struggled with this their entire life? Whatever is going on for them, we know before we get into the OR or before we start engaging in these procedures, where are they BMI-wise? Where are they from a stability standpoint? Where are they from 1, 2, and 3 years ago, and where are they headed? And then we can offer them ancillary services. So we partner with an excellent nutritionist. We have an amazing group of personal trainers, like across the board. We even have stylists that we partner with. So once the transformation's complete and their body fits to where they want, now they have the ability to go dress the way they want to.
I think that's a very important part, and that was really what I was getting at, because after you're done with all of your magic, then it's really up to the patient to have follow-up and continue care to keep the transformation of their body. In the last 30 seconds to a minute, how about you'd like to summarize what you best believe the wave of the future in this is?
Yeah, I think that the future of the aesthetic space is definitely going to continue to be less and less invasive types of treatments. Again, I love surgery. I spend half my week in the operating room and the other half of the week doing aesthetic non-surgical treatments as well. But I think the technology is only getting better, the outcomes are getting better, and we're starting to apply multimodal in a way that we've never done before. And I think that's really going to be the future.
Ladies and gentlemen, Dr. Sachin Shridharani, It has been a pleasure speaking with you and knowing that the future of aesthetic cosmetic medicine in the hands of skilled professionals are the wave of the future. Please allow me to welcome you as part of our esteemed faculty, and thank you so much for taking part of your morning. I know you have to run. I know you're on another panel. We wish you all the best and welcome aboard with us.
Great, thank you. It's an honor to be here, and thank you for a great morning.
Thank you.
Take care.
Great. So, as we know, the future of aesthetic medicine is a long way to go. Every day, every year, we have a whole total array of different modalities, whether it's dermal fillers and neuromodulators, different types of lasers, different types of cryolipolysis. We have the radio frequency, we have ablative, non-ablative laser, and it's these doctors who are the professionals, the skills in the marketplace, along with all of the devices that are bringing the age of nitric medicine, and it is, which brings me on to our next presenter and on my next interview. Where do we go from here? Is it going to be non-surgical medicine? Is it going to be male, female, anatomical medicine and rejuvenation? Is it going to continue to be surgical, non-surgical, med spas, anti-aging? And if I first got into this 9-10 years ago, we wondered, where is it going for the future? And it's now my pleasure to bring on our next guest, Dr. Greg Chernoff.
Hi, Jay.
Dr. Chernoff, it is absolutely my pleasure. We go back a long way.
We're among few of the 30 years here.
Yeah,
but we don't age. You and I never
no,
seem
well,
to age.
no,
It's amazing.
I don't. I age. I'm looking at you. You get younger and younger. The only difference is we have the same color hair, but maybe it's not as much on my end. You recently completed a study, an exciting one-of-a-kind skin serum containing nitric oxide. Can you give me a little bit of information about that?
Jay, for the last 30 years, my center has acted as an alpha and a beta test site for many of the laser companies and many of the skincare companies. And it's rare that you come upon a product that's one of a kind, something that nothing else exists like this. Nitric oxide is a gas that's endogenously formed in our body from arginine. And the problem is our own inner source of nitric oxide is depleted by the time we're age 40 or 50. I was introduced to Nathan Bryan, who's a PhD from the University of Texas. He's one of the most brilliant men I've ever met. He developed an oral lozenge that helps to replete nitric oxide, and he's recently developed a topical serum of nitric oxide. I put some on my hand before I came on. You can see how red it is. Nitric oxide is a very potent vasodilator. So when we use it topically on the skin, it really acts as a source to increase blood supply to the skin. So we recently completed a study on 50 patients, and we broke that study into 4 different components. The first was on an aging skin population. The second was on an acne population. The third was on a wound healing population, and lastly on a multimodality scar therapy population. In the aging skin population, we really found the results to be miraculous, because within 30 days, many times within 2 weeks, patients were reporting a decrease in their fine lines and a tremendous improvement in the tone, the quality of their skin, the clarity of their skin. We saw pigment blending with this. And being a vasodilator, it also then, it doesn't replace anything in your skincare regime. It's really an activator, if you will. It's a primer for anything else they're utilizing. Because if you put this on first, wait 10 to 15 minutes, and then go about your regular skincare regime, it helps to increase absorption of whatever else you're utilizing. So it really acts as a bolster for whatever we're using. In the acne population, we saw a tremendous clearing of pustules, of nodules for patients. We're very frustrated because most acne patients, as you know, utilize many different products, and they become frustrated because they reach a threshold by which nothing else is working.
You
Nitric oxide made a
mentioned that
tremendous
this is
difference.
kind of like a primer. What else would you use it in combination with? And more importantly, why would a patient come to you to use this product? How would they get to know about it? Would they have to come to you first with a specific type of a malady, and then when you look at them, you say, well, I have a magic serum Or I have another option for you. It, you know,
It's really for anyone. You know, these days we're seeing baby boomers, we're seeing millennials, we're seeing Generation X, we're seeing Generation Z. This is truly a skincare product that can be used with anything. So any patient, no matter what their age, would use their cleanser, cleanse their skin, then they would apply Numa, let the Numa work for 5 to 10 minutes, and then go about whatever else they're utilizing, whether it's an HA serum that they're utilizing for moisturization, because this is really helping the absorption of whatever else
how
you're utilizing.
did you find this? How did you come up with it?
Again, Dr. Nathan Bryan from the University of Texas, I had the pleasure of meeting him. He asked us to do a study for them, and it's really been a tremendous eye-opener in the field of skincare, because the patients that we enlisted in the study were so grateful. The third and fourth limbs, the wound healing patients, we are using this now in our surgical population. I pre-treat the areas that we're going to be operating on, and then patients use this for 2 weeks after their surgery. My facelift patients appear to be healing faster. Blepharoplasty patients, we utilized it in some non-healing wounds, so to improve the blood supply around the non-healing wounds, we saw a tremendous
So is
result.
this a supplement to a complement or a replacement for different types of siliconized gels for scar?
I don't think, and that's the beauty of it, it's not meant to replace anything. It's an addition of a product that doesn't exist and didn't exist up until now, and so we're so excited to see how happy patients are, because they're seeing results. At the end of the day, that's what both my patients want and what I want for them. We want them to get a great result as well. And Numa is one of the first products that you can give to a patient and have the confidence that it's something with an ingredient that is time tested. In the 90s, 3 scientists won the Nobel Prize recognizing the importance of nitric oxide in our bodies. It's a substance that's so important in nearly every enzymatic reaction in our body.
Right, so is a retail over-the-counter additional?
It can be bought online. I believe Numa has a website that they can buy it through.
I'm hoping that this is not going to be one of these products that isn't going to be available in non-surgeons' offices, and we won't be able to find something like this on an Amazon, right?
Exactly. You know, I think when you come upon a product like this as physicians, there's a duty to let society know about it, and I think that's why I give tribute to this company, is that they wanted to make it available to as many people as they can.
So where is it available right now? It's a new product in the marketplace.
It's a brand new product. Numa nitric oxide has a website that patients can go to. They're here at the show as well. So exciting new product. We so look forward, and from what Dr. Bryan told me, there's really an extension to this line. With vaginal health, there's a product in the pipeline as well. So
Is this the first of many?
I believe this will be one of the first of many products for Numa that we'll see come through the pipeline.
So this is new. Where do you see the future going with other products like this, so that we're not specific to one product? Do you think that there's going to be a knockoff, that another company will come out? I know a lot of R&D goes into products like this before they actually hit the market, but we all know, like every other product, you know, once patents expire or whatever, that there's always going to be a knockoff.
I think that's the life of products. But I know that Numa has a patent with with this, and again, many other exciting things to come. But there'll always be pretenders come out.
There's always a pretender, right?
There's
pretender surgeons too, right?
No question.
Right.
No question.
So share with me, in wrapping up, where do you see the future of aesthetic cosmetic surgery? You and I go back a while. We've been doing these shows for many, many years, and there's always something different. Where do you see it going?
I think physicians who take pride in the quality that they're delivering will start to look generationally at the patients that they're seeing, because teenagers have different requirements than our perimenopausal patients do. Men have different requirements than women. So I think providers are missing the boat if they're not packaging services, non-surgical and surgical. No one likes the word surgery, so anyone who isn't providing a full recipe of non-surgical options for their patients really isn't providing a complete armamentarium for our patients and considering their aesthetic needs. So I think looking at the different age groups and having specific bundles for those patients and at price points, you know, our whole industry is becoming sadly very commoditized, and you know, cheap isn't always better, and good, you know, good quality treatments you know, don't come cheap. And so I think we're educating patients also to not just shop price, but to shop quality.
Right. Well, Dr. Chernoff, as always, it is a pleasure to have you.
Well,
It's,
Jay.
I'm
Always
glad
great to
that
see
I had the opportunity to be the one to interview you. It's always a pleasure when I see you several times during the year.
Thank
we
you
go
for
back
your
a
long
way.
contributions to our
Thanks
industry
so
as well. We
much.
appreciate you, sir.
And I look forward to hearing the next generation of this type of a product.
Thank you.
Okay.
Thanks for having me.
Thank you. That is my friend and colleague, Dr. Greg Chernoff. We go back a long way, and there's always something new and exciting every time that we meet, and I'm glad to hear and see that he's bringing something new to our marketplace that first time that I've actually heard. Our next guest is no secret to this industry, Dr. Mark Berman, who is a board-certified plastic surgeon, and I believe was one of the major winners of an award from the Aesthetic Show. It was a proud honor to see Dr. Berman. I've been on faculty with Dr. Berman for many years, and it's my honor and a pleasure to speak to Dr. Berman on personal cell therapy. There's always something new in our marketplace. So if you can, speak to me about where is the personal cell therapy going, whether it's plasma-rich platelet, PRP, stem cell. What is it that is going to be new that you're going to speak to us about today?
Jay, it's great to be here with you. Let me tell you, I think we're in a new era of medicine. This is a transition that nobody really expected. There's a book called The Black Swan by Nassim Taleb, and he talks about how there's massively disruptive technologies that come along that you don't expect. When my partner Elliot Lander and I started working on stem cell therapy using your own personal DNA from your adipose tissue, no less, we had no idea it was going to be that big of a deal, but just kept getting bigger and bigger and bigger and more important. We were told we'd be out of business in like a year, 2 years, because there'll be allogeneic product in a bottle. Well, that's the whole bent. Everybody's trying to come up with stem cells in a bottle from somebody else, some other source. The problem with that is we don't know what those sources can have. They could have viruses, prions, things we don't even know about. In fact, you know the only FDA-approved stem cell product right now? It's for bone marrow stem cells from HLA-matched individuals for leukemia patients. Mm-hmm. And if you knew how many people die from that every year, it's outrageous. From 11 to 40% of the patients have serious problems because even though it's matched, they can get graft versus host disease, and then they have to be on medications that can end up killing you. So you're talking about an FDA-approved product that's dangerous. Your personal cells will fix things that you can't even believe are fixable.
Nothing like your own personal cells. You're never going to have any type of reaction to your own, correct?
Bingo. So you don't have a reaction. You can't get an infection. If you had HIV, I'd give back your own cells. I can't give you HIV again.
Correct.
But I couldn't take your cells and make them and put them in a lab because we're humans. Guess what? We're not raised in a sterile environment. Remember with collagen, they had to raise the cows in New Zealand and do all that stuff, keep them sterile? I haven't met a human raised in New Zealand yet in a sterile environment. But,
so where do you see it going? Now, I am a firm believer. I know for many years in different administrations, they wouldn't allow stem cell therapy. It didn't become legitimized. It wasn't legal to have. I'm a firm believer PRP and stem cell therapy. I mean, I personally had bilateral medial epicondylitis. I had it. It works. And there's nothing like taking something from your own body, right? Where do you see the future of this going, especially now? You as a board certified plastic surgeon, and I ask a lot of times, plastic surgeons, how do you get into many of the alternative measures of medicine? I mean, you're always going to be a physician. What brings you into this?
It's a great question. Two good questions, the future and how we get into it. Everybody used to criticize, what's a plastic surgeon? I'm actually a cosmetic surgeon. Mm-hmm. But how do we get into that area from cosmetic or plastic surgery? And the answer is we started working with fat. Years ago. I've been doing fat transfer for over 30 years.
Right.
I know I only look 65 even though I'm 66. I've been doing it a long time. And the reality is that the adipose tissue started working in the lab to figure out how we can grow more adipose. And you can grow a whole bunch of fat, but it all dies unless you have stem cells associated with when you inject it. So we learned accidentally that there were all these stem cells in fat. And from that, people started working on isolating and seeing what could grow out of those stem cells. You understand your fat is part of your structural
Correct.
body. That's what we call the mesoderm or mesenchymal system. So it turns out that cells in fat are mesenchymal stem cells. They can turn into bone, cartilage, muscle, nerve, fat, connective tissue, all these different things. And it's amazing because they can go and repair all these things like they did on you. I've had it done on me. I had it done on me just 3 weeks ago for a little sciatica thing I had. This stuff is amazing because it works so well. The future will be that we'll be able to take our cells, not just fix each other as point of care, but bank it and grow it and expand it.
Well,
so
that
we'll
was
have it
going
for
to
the
ask
future.
you about storing it, because look, I may not hurt now, I may not have a problem now, but one thing I can guarantee for the both of us, we're probably the same, we're the same age, you look a lot better than I do, but with that being said, what is your belief about storing it for the future? Because the younger people, look, we're going to get different types of, with osteoporosis, we're going to have different bone diseases, we're going to have different losses. If we're going to store it, how long do you think you can store it for? Just like people now freezing eggs.
No, you can store it forever. It's stored in liquid nitrogen at temperatures minus 190 degrees centigrade. So probably be able to store it indefinitely. And if we can keep multiplying numbers of your own cells, that means you potentially get your own DNA back and live even longer, healthier for a long, long time. I mean, we're talking about maybe 150 or 200 years. There could be great socioeconomic ramifications from having cell therapy. You realize we're just made up of cells. The only reason we get old and start falling apart is because we lose cells over time. My face is older looking because I've lost cells, particularly fat. That's what I started doing. It led me to the stem cells. And now I understand this is going on inside your body. Why don't people live beyond 120 years? One day you just don't have enough cells in your heart to conduct a heartbeat and the game's over. We can keep giving people back cells to make their heart stronger, healthier, and live longer. We can reverse things that have been irreversible. We're doing it right now.
Mm-hmm. Now, you're mentioning one major organ, the heart, with the heart cells, but how about the liver and the kidney and the spleen and all these other things? Cancer is our #1 demon right now. Do you feel that the stem cell therapy will aid and assist in the reduction of cancer cells?
In a different way. The liver you mentioned, rarely, if you're reasonably healthy, you never die from liver failure. You'll die from your heart or your brain before your liver. Your liver makes its own stem cells continuously through the biliary tree. It's a very interesting organ. That's why it can regenerate so well. And you can take part of a liver, transfer it, and grow a whole new liver back. But with cancer, the stem cells won't cause cancer, but what they do is they can go right to cancer cells because they're causing all this inflammation. Now, what we found, and we did a short study that was disrupted by our friends at the FDA, but we found that there's all these different things you could put into your stem cell to deliver to the cancer that could kill the cancer. For example, there are viruses that will kill the cancer, but your body will kill the virus. The vaccinia virus that we use for smallpox was the one we were researching. It's amazing. It can kill cancer without any side effects, because when it's done killing the cancer, it's released in your body kills it and gets rid of it. But there's chemicals and things you can put in. So there's doctors who've been working on putting chemotherapy into stem cells and use the stem cell like a Trojan horse to go to the tumor and deliver the medicine. So there's a lot of options for it. I don't think the stem cells are actually going to be cancer killers. They're there like those refueling ships in the sky. They've got all these cell components that you need to make your cells healthy. Or if your cell's actually dead, but it has enough messenger RNA, it can be signaled to replace or repair that cell. So
what type of patient do you recruit to have this type of a treatment, and how would they get to know? Because look, in the age of cash-based medicine, right? It's all about marketing. It's all about getting people to know that Dr. Mark Berman is the go-to guy. So a new surgeon coming into the market, coming out of their practices, how would they get into this? How would they get a patient base to be able to come to you? And what is the best type of a patient base to recruit to?
Well, Jay, we started an organization called Cell Surgical Network about 8 years ago, where we actually teach our technology to doctors who want to learn this. So it's very safe, very simple. Most of these people at this meeting all know how to do liposuction. We changed the technique a little from tumescent to subdermal block. It's simple, it's safe, it's amazingly easy. But what we encourage doctors to do is work in multi-specialty teams. So the first patient I ever treated, I worked with an orthopedic surgeon. And today, my partners are urologists. We have orthopedic surgeons, cardiologists, interventional radiologists, and other specialists who want to work with us, neurosurgeons, neurologists. And they all have their patients. The way I look at our cells is the way penicillin was years ago. When you first got penicillin, there'd probably be clinics that you would go to get your penicillin. But every doctor should have access to penicillin. Every doctor should have access to personal cell therapy. Ultimately, that will be the future. So everybody will get treated. If you had a concussion, you get cells right away, you'll get better. My son did a study on rats. We've done basic science studies that have led us to humans that have shown concussions completely reversible within the first 24, 48 hours if you get cells to that patient, your own cells. So if you don't have them stored, you get what you get. But if you have your own cells, at least some fat and something available, you get those back.
Okay. Dr. Mark Berman, it is a pleasure to see you every year, as always. Thank you for being a pioneer in the new ages of different types of medicine instead of just the regular. Thank you for assisting in helping us to live longer. You're saying 120, 140. I don't know about that one.
We're going to have to work a lot harder.
Thank you so much.
Thanks, Jay.
Okay, it is my pleasure for Dr. Mark Berman, and now we're going to get to turn it over to Dori Sukup, going to be interviewing Dr. Sunil Chilukuri.
Hi there, Dori Sukup here, founder of Inspiration Management. I am here at the Aesthetic Show live at the Wynn in Las Vegas. I have a very special guest for you today, Dr. Chilukuri, all the way from Houston, Texas. He's the founder of Refresh Dermatology.
Thank you.
Truly
That's
an honor
my honor.
to have
Are you kidding me?
here.
If you don't know Dori, I tell you, she does amazing work. So it's a real honor because you
Thank
grow
you.
practices in an aesthetic way. It's so neat.
It is.
know?
I'm super excited to be speaking with you. I
It's a
know you're a
pleasure.
very busy man.
No,
You are a speaker. You're a physician.
Yes.
You speak internationally and nationally.
I do. Thank
you teach clinical.
We do.
Oh
we
my
enjoy
gosh,
it.
it's like, how busy are you? What an accomplished young physician
No, you're very
you
kind.
are.
You're very kind. But my favorite part is still being a dad. You know,
Yes.
that's the best part.
That's-
and we
that's the
really
best
enjoy
thing.
it. It is. It's so much fun. But all this technology is going to relate to our children. And that's the
Yes.
fun part because we're able to do things preventative today compared to when we were growing up, right? We were always playing catch up. And what I talk to our patients about is if you can stop that process or you can prevent that process from coming, how often do you actually have to come see me?
Exactly.
Once a year, twice a year, versus if we're playing catch up, I might have to see you once a month to
Yes.
get you back to where your baseline and then maintenance along there.
Well, actually, that's a great place to start because the millennials are going to medical spas like crazy.
It is.
And it's amazing how much younger and younger people are that are coming in for Botox and fillers.
Correct.
And have you been seeing such a big shift in your practice as well?
We do. You know, we've been close to new patients other than internal referrals since 2016. So almost 3 years we've been close to new patients. Even with that, we're finding that mothers are bringing their daughters in,
Yes.
fathers are bringing daughters and sons in, and just asking, is there something they should do? And 99% of the time, it's skincare. Right? We talk about using a retinol. That's the
Yes.
most important thing you can do. And then second most important thing, in my opinion, of course, it's not the most popular opinion. The second most important thing is your sun protection.
Yes.
So oftentimes it's reversed. Number one is sunscreen. For me, if you use a retinol, you're actually regulating the turnover of skin.
Yes.
So if you can turn your skin over every 7 days rather than 30 days or 40 days, what does it
Correct.
do? It's going to prevent aging. It's
Yeah.
going to prevent static lines, and it's going to help the skin just look healthier.
Yes.
So we do that as preventative. But you're right, people are asking for Botox and fillers, and the number one thing that we see for millennial women is lips.
Yeah.
And they see this craziness that's out there.
Yeah.
We're seeing, I mean, everybody's Insta famous, right? And so they're coming out with these huge lips. And I had
Yeah.
one lady come to me and I said, no, you're done.
Yeah.
She came from somewhere else. I said, no, you're done. I said, if you'd like, I can dissolve a little
Yeah.
bit. And she says, no, I want my lips to look like this. And I didn't recognize the person, but then the young lady in the room who's helping me,
Yeah.
our team, she says, oh, this is so-and-so. I said, I have no idea who that is. So she pulls up the picture. And it's a Real Housewife, and I can't remember if it's
Oh,
Miami
wow.
or something. But now her daughter looks the same with all
Oh,
these jacked up
no.
lips. They have two
Oh, no.
sausages. So I said,
Yeah.
no, we can take that out.
And that's one thing I think physicians, you have that resposibility to tell
100%.
someone, time out. you're done.
100%.
No more,
Yeah,
please.
you're exactly
now,
right.
I know you're very famous though for the
Thank you.
liquid facelift.
I do, yes.
So tell me a little bit about that and
Yeah,
how
sure.
did you get into like loving that particular
It's
procedure?
so interesting. I trained in surgery and then I did dermatology, so we learned about the skin. And then I went back and I did a little advanced training in both skincare surgery as well as doing lasers. So I said, okay, if we're using a facelift and we're putting these threads or we're putting these sutures in to lift this up, disposing of the old skin, what can we do? Is there some way that we can recreate the structure? And with technology that we have today, it's remarkable. So we have tools in our toolbox that 20 years ago, 22 years ago, we just imagined. We
No.
said it's impossible. We
Yeah.
can put the fat in there and for 6 months you're not gonna look good. We used to do these fat grafts on the lips and
Yeah.
you have these huge, massive lips, it's crazy. But really for 3 months, the lips look terrible,
Yeah.
right? And sometimes even 6 months. But now if we can reproduce a excellent result within a couple of days or even a week or less, sometimes even the same day, I'm just putting the structure where we used to put the suture in.
I see.
And I think that's the biggest difference. And in our office, we call it a C lift. And what does it stand for? Well, if you look about it, the C is an upside down C. You pull everything up from that C. And then what's the C lift? You can also say it's a chillicuri lift. And why do we say
Yeah,
that?
I like
But,
it.
well, it's just different, right? And so what is it? It's something that's not reproducible because
Yeah.
you're not the same as me.
That's
You're
true.
not the same as your son,
Yeah.
right? You're your individual person. So what you need today versus what you need in 3 months even,
Exactly.
versus 6 months is going to be different. So every single time we're varying it. But I think that's where the physician expertise really comes in, is to kind of fine tune. When do we add an energy-based thing? When do we put a chemical peel? When do we do another filler?
Right.
When do we use a neuromodulator to regulate how strong that muscle is?
Right.
And putting that in combination is what makes anybody an expert
Yes.
in this field.
As a matter of fact, my talk earlier today was exactly about how to perform a consultation and create multiple treatments within this customized
100%.
package. And a lot of people, I feel, are missing out on that opportunity sometimes.
Right.
So I'm so glad to hear you say that you combine different
Always.
modalities. Now, though they're non-invasive, I know that we need numbing cream
We do.
to help patients
Yes.
minimize
Yes.
the discomfort.
Yes.
No pain,
Yes, no
discomfort.
pain. No pain.
So, are there any new technologies
There
with
is.
numbing creams?
There is, and I'm glad that you asked that. So what you're going to talk about at home is really understanding what's out there. There's BLT. We've been using it for years. That's betacaine, lidocaine, tetracaine, and we changed the percentages, we changed the bases and things like that. This day and age, there's something that's coming to the market. It's brand new. It's called Prevedine, P-R-E-V, so prevent,
Yeah.
D-Y-N-E, any kind of dysphasia,
Nice.
dysania. So you want to prevent discomfort,
Yes.
right? And it's a 4% lidocaine. What's unique about it is the base, and it's all about the vehicle. And that's what we've been talking about in the dermatology space for 30, 40
Long
years.
time.
Long time, really understanding the science. And when you say a professional grade product, why does it cost 3, 4, 5 times more than, let's say, that you get a Neutrogena product? Why? There's more science behind there. This is something that's very reasonably priced. I actually give it to the patient as part of our package because we don't want them to be discomfort,
Yes.
have any kind of discomfort. And if you put it on 5 to 10 minutes before a procedure, it's numb.
Wow.
Think about this. If
That's
you can go to
nice.
the office and you can do something around the mouth, which is
Yeah.
quite often, it's very painful. If we can do something around the mouth, 5 minutes and not block up a room,
Yes.
what can you do?
Beautiful.
You can really change a person's life, but you can also
Absolutely.
change your practice to where you're more efficient, your team is more happy,
Yeah.
and at the end of the day, for me, it's the patient. The
Yeah,
patient has to be the happiest.
Absolutely. Let's talk a little bit, since I'm a business advisor, let's talk a little bit about some of the things that I saw you do
Certainly.
that I always want many people to do,
Thank you.
and that's video.
Oh, yes, thank you.
You have some amazing
very
videos on
kind.
your website, and I think that a lot of people can minimize so much of the patient consultation process if you let them sit in a room a little bit before the procedure and just go over like most frequently asked questions
100%.
to cut down that repetition that you have to repeat yourself
Correct.
over and over and over, and that's something that you should really minimize.
Right.
So when I was on your website and checking
Thank
out all
you.
your videos, you have some great videos,
Thank
and that's
you.
one thing I'm always telling people to do is video marketing.
Right.
So when did you get into doing videos, and how have you seen it change your business?
So it's interesting. I'm glad that you asked that question because videos are for, I think, the new generation of blogging. So when we were kids, what happens? We read a book,
Yes.
right? And then they go to this tablet, this Kindle, and then from the Kindle, they don't even want to read anymore. They just want to
Yes.
hear people
Yeah.
talk. And it went to podcasts. From podcasts, as things got more advanced, now we can do videos. So the advantage of video is just like you said, patient education.
Yeah.
And the most important thing for us in our practice is really educating the patient. You want to talk about, number one, what is it going to feel like? Number two, what to expect on the day of the procedure. Number three, what to expect immediately afterwards, 1 hour afterwards, 1 day afterwards, and how does it make a difference? And so when patients kept asking, well, what is it going to look like? I used to take pictures, but sometimes the background looks funny. And then what we've changed from is doing these professional videos where we'd hire somebody in, they have these fancy cameras like these guys here behind here, to using our phone.
Yeah.
So with the technology change, really it was the iPhone 6, so I think that was 4, maybe 5 years back, 5 generations ago.
Yeah.
The camera is so powerful. And today with what's out there, with the Samsung, the Androids that are out there, and with the iPhone 10s or something like that, the camera's a
So
4K
easy.
camera. It's easy. And so we spend a little bit of money on Amazon. So a little bit of money really means a little bit. It's $30, right? We buy a professional stand. We put that stand up. Then I spent another, I think, $12, and I bought a microphone that goes up through the suit.
Yeah.
And you can hear everything nicely. And so I've changed from doing the professional to a live video. And
Yes.
oftentimes with
Love
the
it.
platforms that we have Facebook,
Yeah.
we have Instagram,
Yeah.
we have Snapchat. And the reason I changed that way is so we can interact and say, hey,
Absolutely.
Dora, is this hurting?
Yeah.
Because if this is hurting, I need the patients at home
Yeah.
who are watching to know that.
Yeah.
So on our social media
Love it.
challenge, it's just at Refresh Dermatology,
Love it.
we have a whole video section. So we shoot 1 or 2 a week, and
That's great.
it's just fun.
Yeah, it is. And this is something that we practice all the time. I love video marketing, and it's free.
It's free.
That's the best part. It's free.
Crazy.
You are just such an inspiration.
pleasure.
It's such a pleasure to have you here.
My honor.
Great to meet you.
It's a pleasure. Thanks so much for having us.
Thank you for having us.
It's a pleasure.
Dori Sukup signing off from the Aesthetic Show Live. Hi there, Dori Sukup here, founder of Inspiration.
Okay, welcome back. I have the pleasure of interviewing Dr. Christian Subio, a board-certified plastic surgeon, Subio Plastic Surgery, from my hometown in Philadelphia. It's a pleasure to have Dr. Subio on our panel. We're going to be speaking about the advancements and how to incorporate radio frequency into your practice. So, Dr. Subio, welcome aboard. It's a pleasure to have you.
The pleasure is mine. Thanks for having me.
Explain to us, with all the new innovations out there, as a board-certified plastic surgeon, most people think of plastic surgeons as surgeons, and you'll never get rid of that. You go to medical school and you go through your general surgery, and then you go through your plastic surgery. And most people think of it as breast aug, tummy tucks, liposuction, and then we have lasers and radio frequency, and there is a new radio frequency device. I'm not going to name any specific manufacturers, but how do you incorporate radio frequency devices into your surgical practice? Is it you, mid-level providers, estheticians? How do you incorporate it?
Well, I think the first step is really figuring out, just as you mentioned, there seems to be a new device coming out every week, every month, just dozens and dozens of devices. You have to figure out which ones are actually efficacious, which ones are just smoke and mirrors and snake oil. And unfortunately, there's a lot of misinformation out there. So step one is figuring out which of those devices actually deliver the results that can bridge the gap between, non-invasive and invasive. And so once you find and figure out which is the right device for you, as you mentioned, is it going to be myself doing it? Am I going to delegate that duty? And it really depends upon which form of RF it is. Those which are less invasive, more topical, I can delegate to my nurse or esthetician, assuming that the risks are low. And if it's something that's more invasive and carries a little bit more of a risk profile, then I myself would do it.
With the inception of all these radio frequency devices, what do you choose to specialize in for RF? The face, the body, male sexual health? Which is your preference? I mean, you're a plastic surgeon, which deals on the entire body. So when you bring RF in, what do you feel you get the best results?
I really use it everywhere. That's one of the beauties of these devices. RF energy, depending on the platform, can be used from head to toe, as you mentioned. It can be used to rejuvenate the upper face, lower face, neck, body, feminine rejuvenation, all different applications. I myself, I like to specialize in, facial rejuvenation and then the body, the abdomen. Not so much the breast, but, those two areas.
Right. Do you use it in combination with other procedures like laser assisted and RF device together, or do you choose when a patient comes in, naturally they're coming to you and they're saying, Dr. Subio, this is what bothers me the most. And now it's up to you to determine what you feel is going to be the best efficacious result for them. How do you determine that when you bring in an RF device?
It's really, number one is having a device or a couple devices which can address all of the patient's potential needs. As you mentioned, one patient might be coming about her neck, or another patient might be coming about his abdomen. So you always start with what bothers the patient, what is bringing them into your office, so you can focus on what's going to make that patient happy. Because if the patient is concerned with her lower neck and face, and I'm looking at her brow, it doesn't matter what I think. It matters what the patient thinks. So you try to find whatever's going to make them the happiest with what bothers them when they look in the mirror.
Well, dealing with the aging face, with RF devices, what do you feel is the average age patient? And then I'll get to my second question is, what do you think the most popular gender is? Because naturally with the male face, it's a little bit rougher and tougher. It doesn't bother us as much. We can hide it with a little bit of facial hair. So age and gender.
As far as age, I would say just very roughly, it's probably between 30 and 60 is the sweet spot. It's a wide sweet spot.
It's wide.
On the earlier age, if someone's in their late 20s or mid 30s, they can benefit from RF energy as a prejuvenation effect. And I don't think that's smoke and mirrors. I think there is some value to that. So you can sell it to these patients as getting ahead of the curve, preventing these changes which otherwise down the line might require surgery. Later on, 40s, 50s, 60s, once a patient's in their 70s and maybe 80s, there are limits to what these technologies can do. So, the further along you get, the further the skin changes are, that's when you start to your point earlier, you start to combine it with other therapies, because RF energy, in my experience, provides a mild to moderate result. It's never going to be a home run in and of itself. And you have to be careful with that, because some companies will try to sell it that way. But it is not a home run by any means. It's a subtle result in the best of hands. So oftentimes I will combine that with laser, with liposuction, with PRP, multiple other modalities which in themselves have mild results when combined, give an additive synergistic effect, and that's when it becomes more useful for those patients who might have more significant changes.
Naturally, when this occurs, and you have some patients that are not candidates for surgery, maybe health-wise, because generally, if you're not going to put them to sleep, but if you're doing something like sometimes under conscious sedation, might be a different story. Do you explain that to the patient that we're introducing an RF device? It's not going to be the miracle that you're looking for. It's just going to give you a more refreshed look.
I think that is key. That's one of the most important things when it comes to selling an RF result to your patients is honesty, transparency, and setting the expectations appropriately. Because again, so many of these device reps will come to your office and they'll be showing these doctored pictures or misleading pictures with tangential lighting. It's very easy to be fooled into thinking that these devices give an amazing home run effect. So you have to be very careful when selling these to patients, prepare them that it's going to be a subtle result, because if they're prepared for that, afterwards they're going to be happy with the investment they've made. But if you're selling this as a replacement for a facelift, guaranteed they're going to be very unhappy. You're going to get negative reviews. You're going to be it's headaches down across the board. So honesty, transparency, it's just the right thing to do.
Do you have a patient sign a release or any type in their consent, letting them know that? Because look, we all know patient expectation is key. And you can deliver the best results that this radio frequency device can provide, and it still may not meet to the satisfaction of the patient. And they'll say, but you know what, doctor, you never told me that, and you know that you did.
Yeah, I've been there, and it's a great question. It's a very important topic. I would say that photo documentation is essential, because so many times, as you know, patients forget the improvements. They look better, but then they get used to that and they forget how they looked prior. So excellent photo documentation is paramount, and having a long, honest, thoughtful discussion with the patient, setting those expectations. But like you mentioned, they often don't remember that conversation. So not only having the conversation, but documenting it so that afterwards you could show them the picture. Well, hey, look, this did effect a good change. And hey, we did talk about the potential that this is not a replacement for a facelift. So documentation is key.
Knowing that, how do you choose in your busy schedule as a plastic surgeon who provides the RF treatments? Because many times plastic surgeons cosmetic surgeons that are busy in the operating room all the time, delegate that to either mid-level practitioners vis-a-vis whether it's a physician's assistant, nurse practitioner, and even estheticians. So how do you delegate who provides that device in an RF?
It all kind of works out because I do it based on risk and the level of skill and training that one needs to effectively and safely operate the device. If the device is very safe, very easy to use, very low chance of risks, then yes, that's something I will delegate to a nurse or an esthetician. However, if it's something that does carry more risk, it works out because those treatments often lead to more dramatic results. They're a higher price point. There's, patients understand more risk, more price, more expertise, and so those are the ones that I tend to take on myself.
Do you usually try to sell a patient on RF device on packages versus a one-time treatment? Because I think, in our former practice, we've had where there's different RF devices that you do so much better if you stage the treatments.
Yeah, almost always. There's certain exceptions, like I have the InMode device, so for FaceTite, that's a semi-invasive treatment, so that's only going to be once, but luckily the effect is more dramatic with that device. The lesser invasive devices, always it makes more sense for me to sell a package. I have a long discussion with the patient telling them that, look, this is a stepwise approach. There are treatments out there where, aggressive chemical peels and laser peels that can have downtime for 6-8 weeks even. Or we can have an additive device that, you may have a day or two of redness, no significant downtime, and we creep towards that effect.
Great. Dr. Subio, thank you so much for your time. We really appreciate it. I wish you the best of luck and continued success.
It's a pleasure. Thank you so much.
My pleasure. Thank you. So, that was Dr. Christian Subio from Philadelphia, Pennsylvania, and he basically was speaking on the elevation of bringing in radio frequency devices into your practice. I would like to introduce our next guest, Dr. Ezra Dayan.
Hi.
All right,
Thank
it's
you
my
for having
pleasure.
me.
Thank you. And we're going to be speaking on holistic approaches to aesthetic treatments. Dr. Dayan, welcome aboard.
Thank you.
It's a pleasure. This is the first time I've had the opportunity to speak with you on a panel or any of my sessions.
Thank you.
Introduce how we bring in holistic approaches, because years ago, nobody ever wanted to really listen to holistic. It was always on the eastern parts of the world that holistic approaches, and now today, integrative, regenerative medicine is so popular.
Right.
How do you introduce holistic approaches into traditional medicine today?
Well, I think it's a great question, and holistic really means looking at the person as a whole. And I think we're going through a trend in aesthetic medicine and aesthetic surgery where, let's say in the 90s, early 2000s, people were injecting, much more, we're talking about hyaluronic acid, silicone implants were popular. And now we're going through a phase where, and this is not just the aesthetic industry, this is how we eat, exercise, people are much more aware of organic foods, what materials they're wearing. So I think all those things play into what the public desires. For example, if you look at fillers, there are new products that are not so much synthetic. They're allograft cadaveric fat, like MTF makes a product called Renuva, which has become very popular. And those are the kind of patients that don't desire the synthetic fillers. So I think having those kind of products available and being aware, PRP is a great example. People want to look natural.
Dr. Berman just
he was talking about that, right? So yeah, I think PRP is a great example of people often prefer when you're volumizing to use their own fat, to use their own PRP, and I think those things are very important for us to meet the patient halfway and really be aware of what they're looking for.
So when you first meet a patient and they come into you, they're coming in to see you with a specific goal in mind.
Right.
Whatever that is. Whether it's fillers or whether it's skin tightening or whether it's skin care.
Right.
When you meet that patient and that's first introduced to you naturally, hopefully your staff has already tried to get some of the tricks of the trade and bring what that patient's questions are to you. How do you determine holistically what is the best treatment for that when there's so many out there today?
So it's a great question, and I'm giving a presentation tomorrow on this exact topic. And I think for me, being a plastic surgeon, you have to have a very good sense of where your patient's coming from, what their goals are, what their budget is. All these things are important because if any of those things are not aligned, you simply won't make the patient reach their goal and they're not going to be a happy patient. So I think part of the problem with medicine in general is we're very segmentalized. You know, the plastic surgeon is looking at what the plastic surgeon can do. You know, is it an excisional procedure? The dermatologist is more focused on skin care, resurfacing. The esthetician is looking at it from a different angle. I think a huge value, and something I'm very interested in, for example, I look a lot at energy-based technology, and looking at the patient as a whole, because you know, it's like when you get your car taken care of. If they give you your car back and it's dirty, you don't feel like it drives well.
Right.
And it's the same thing with plastic surgery. We do a lot of skin resurfacing, and it's kind of, it's really an analogy. You know, if you come out of a minimally invasive facial aesthetic procedure or a facelift, and you still have dark spots on your skin and you still have wrinkles, you may look better, but not as good as you could. And I think a lot of times we overlook the whole picture. You know, the patient is not thinking about all the details and technical details. They just want to look better. And I think, you know, all the ways we can do that, and that comes down to experience. You know, there are technologies that work, there are technologies that work less well, and it's our job to look into the science, look at the results, and figure out what is really effective.
So when a patient doesn't qualify for specific procedures, and holistically you're looking at them almost from a primary care physician's type of a role, even though you're a plastic surgeon.
Completely.
Right?
You have to be very honest with the patient. One thing I've learned, you know, I'm a young plastic surgeon. As a young plastic surgeon, you know, you're motivated, you want to help the patient, you have a whole armamentarium, and you just want to be on their team, you want to make them better. A great way to be on the wrong team is if you try to offer them something that doesn't work. And if you try to, you know, fit a square peg into a circular hole, it just won't work. And I think some of my patients that are the biggest advocates for me are the ones I never touched. Because I told them, I don't think I can achieve your goal. And I think that's part of the holistic view of a patient. You know, this is taking care of people and helping them reach their aesthetic goals.
But isn't there always something that we could do? If it's not surgery, some patients aren't candidates for surgery because they can't be put to sleep, or they just may not be that fit. They need a tummy tuck, and liposuction just won't do it.
Right.
But yet there are certain procedures that you may be able to offer. I've just interviewed several doctors that incorporate radio frequency. Some are doing lasers, some are doing PRP, stem cell, traditional plastic surgery.
I totally agree with you. There's always something, luckily, you know, the aesthetic market is growing, and particularly the non-invasive market. You know, there's a concept called the treatment gap. And what that is basically is if you think about patients, there's three groups of patients. You have the young patients, and those are patients you can do Botox for, fillers on, skin care. And then you have the older patients who really need more excisional operative removal of skin, lifting, soft tissue. That middle group of patients is growing. You know, patients in their 40s, 50s, they're not kind of quote unquote bad enough to require an excisional procedure, but you also can't satisfy their needs with the more minimally, you know, the injectables and the Botox.
Correct.
And I agree with you. There's a big opportunity there to take new technology and apply it to that patient group. I think the key thing is making sure, and with social media, this is, you know, social media is a great tool.
Well, that's where I'm going to lead into.
Yeah,
so
you
go ahead.
really want to make sure that their expectations, that they're not trying to get an excisional procedure result with a minimally invasive device. And I think figuring that out is critical. For me, imaging is very useful. You know, taking their picture, morphing it, and seeing where is their mind, what are they trying to achieve, and can I get there? And also social media. You know, in my social media, I'm quite active on social media. I don't necessarily show the A+ result all the time, because once I do that, I will get a good response, but then a lot of people are expecting that. So I try to keep it very realistic.
Right. You talk about social media. I work with several physicians that are clients of mine that are all over the United States that are very, very heavy into social media, and they've got tens and thousands of followers. And they show all kinds of results.
Right.
As a young plastic surgeon, and I bring that up because you mentioned it, not me, right? As a young plastic surgeon, how do you differentiate yourself from those of the more experienced surgeons who are also very, very heavy into the social media as well? And I'll bring up, for example, because I believe one of the people that started the social media craze was Dr. Miami. He's basically, he's based in South Florida.
Sure,
where
yeah, I know him.
All right, everybody knows
Right.
that's in the social media marketplace, but I'm not trying to promote one way or the other. How do you differentiate yourself when you're looking at it? Because you come at it from a totally different perspective.
I think it's a very important question. I think social media is a tool, and it's a tool to demonstrate what you do, what your skill set is, who you are. I mean, for me, a lot of patients come and they know a lot about me already, and they've actually, frankly, I feel like they've already signed up because they come in, they've seen my results, they've seen what I do, and they trust me. Now the question is, who am I versus someone who's been in practice for 20 years? And it's a great question. And I think honesty is everything. You know, just like I said now, I'm a young plastic surgeon, but being a young plastic surgeon comes with some benefits, meaning I'm most up to date on a lot of the latest technology. I've done a lot of the research on a lot of those devices. You know, sometimes there's a value in that, and there's a lot of value in experience. You know, if you have 30 years of experience, that's a tremendous value.
Well, I want the most experienced pilot.
Right.
All right, when I'm on an airplane.
Exactly.
I don't mind, you know, a young plastic surgeon in medicine, but I want the most experienced guy on the airplane.
And I think that's totally valid. I think for me, you know, personally, I think everybody's you know, an individual, and you know, I trained at some of the best. You know, I trained at Harvard. I did a lot of the studies. So I think that those things are, you know, just to showcase who you are. I have 3 kids, so I think all those things I showcase on my social media.
Perfect.
And tell them about me.
Right. Dr. Dayan,
Thank
it is
you
a
so
pleasure.
much.
Thank you so much for taking time
My
out of your
pleasure.
busy schedule to speak with us.
Thank you.
Okay. That's great. That was Dr. Erez Dayan from Nevada here. And I would like to introduce our next guest, who is no secret to our industry and actually a personal friend of mine. I'd like to introduce Dr. Jonathan Kaplan, who is a board-certified plastic surgeon and commonly known as Dr. Bay. Dr.
That's right.
Kaplan,
Great to see
it
you,
is a
Jay.
pleasure. I love the colors.
Thanks.
All
Got to
right.
do it for the gram.
You did it for the gram. Okay.
But yeah, just that you mentioned, I'm Dr. Bay. I am Jonathan Kaplan, a board-certified plastic surgeon in San Francisco, but because I'm in the San Francisco Bay Area, my social media handle is Dr. Bay, but instead of B-A-Y, like Bay Area, it's B-A-E, just trying to sound a little more hip for the millennials.
Well, that's great. I'm a millennial. They just call me a baby boomer, right?
Right,
So,
exactly.
I've known you for many years, and as a board-certified plastic surgeon, you've gotten into social media and price transparency to show a different reflection to help doctors in our industry portray themselves in a different way. So if you could, speak to me about how you enter and entertain social media.
Yeah, I mean, you mentioned price transparency and social media. It's all part of it's all different sides of the same coin. It's all really about transparency. The consumer is looking for that kind of to know their doctor a little bit better, and you know that's what review sites were pretty good for, or other websites where you could learn more about your doctor or just their own website. But social media is the ultimate in transparency, because if you do social media in the right way, it's more than just an Instagram feed of like your before and after photos. You can use things like Snapchat and Instagram stories where you can actually show the consumer what you do in the operating room, or when not even in the operating room, if you're doing injectables or non-invasive devices, you can show them how that procedure works on a real patient who's willing to sign away that they'll be willing to be shown on social media. And it really is just a great way to give the consumer a better idea of what they're considering and what they may get done.
There's a lot of hype, positive and negative, about social media. You know, I personally, I don't do a lot of personal social media. I do in our business, but
Absolutely.
I don't own the personal side. But share with me, if you will, what is the number one? I mean, I hear Facebook, then I hear Instagram,
Right.
and then some people say Snapchat and Instagram Live. You know, there's so many different ones out there, and some of the doctors say to me, I will never use that live stuff because I don't want to be considered a clown running around the operating room, but yet there are very good professional ways to do it.
Absolutely. So, yeah, I think that there has been some people who have given social media a bad name, but it absolutely is not the way it needs to be. I know there was like a doctor in Atlanta that was dancing on YouTube, and it just doesn't have to be that way. You can really be whatever. What I always tell people when I'm lecturing about this is that whatever you normally do in the operating room, like when you're operating or maybe you're explaining the procedure to the other people in the operating room, that's what you do on social media. You just do what you normally do. You're not normally dancing in the operating room, so don't dance on social media.
Right.
But as far as breaking it down, which platform to use? If you're going after the facelift crowd, go with Facebook. That's not why they named it Facebook.
Correct.
Go with the facelift crowd is a great way to, because older people, the older generation, 50s, 60s, 70s, they're on Facebook. That's a great way to get facelift patients. Rich Castellano, our friend in Florida, he's really big on Facebook, and he gets a lot of that type of patient. Snapchat, if you're really just getting started on social media, I would not start Snapchat. I've already been doing Snapchat, so I continue to do it, but don't get started on that. If you're really going to start something new, go with Instagram. It's got 500,000 daily active users, and it can't just be Instagram. It's got to be Instagram stories. You've really got to be telling a story. Their algorithm is pushing more towards that. There's Instagram TV, there's Instagram Live. I mean, there's so many iterations of it that we can't really cover right now. But if you're really going to start something new and you're trying to get anybody from the age of 18 to the late 40s, early 50s, Instagram would be where it would be at.
You bring up a very good point. With many of my clients throughout the United States, they start and they want to get on social media, yet they, without going to a third party, for example.
Correct.
They can't get the amount of followers up there. They'll get, and they say maybe 50, 100 people are following them, and they'll post 2, 3, 4 times a day. Here's a couple questions for you. Number one, is it wise to have somebody in your office handling that may not necessarily be the skilled professional, or should you have the website companies, social media companies handling it?
Right.
How many posts should you do, and what's the best way to increase your followers?
Right, so you really can't outsource this, because if you're doing social media correctly, you're doing things in the office every day. You can't have some company that will send somebody in every day. I mean, obviously that would be prohibitively expensive if you're outsourcing to somebody else to then send their employee in to do your social media. You can't really do that. You have to have somebody in your office, and you don't even have to hire a dedicated social media person. It could just be a millennial that's working at your front desk to do your social media to help you with it. And as you build up a practice, you get busier, and you get to a point where I have hired a specific social media person that's just in my office, only doing social media. So if you're just getting started, I would definitely just have somebody in your office doing it, and the whole office has to buy into it. You can't have people saying, oh no, don't put me on camera. I'm not saying that they have to do juggling tricks and things like that, but everybody in the office has to be a part of this, because it is a full-time job for everybody. So everybody has to be at least willing to, maybe their face will be scanned in the passing, but they can't just say refuse to be a part of it. So you have to have everybody in on it, hire some, and if you do get busier, hire somebody else. But you really do have to start, and you have to be all in. That's the hardest part about it. You can't just do it like once every now and then, because you never will build up an audience. There are different other Instagram pages you can work with that will like repost your photos and things like that to help get you a little bit more of an audience. Don't buy bots, that doesn't help you. Don't do anything shady, that doesn't help. You can do different giveaways and things like that. Not like giving away a procedure, but we did one thing where we gave away some Louboutin shoes. We had a bunch of people in the San Francisco Bay Area enter the giveaway and started following us and get exposed to us. And some of those people, after they don't win the shoes, maybe they won't follow you anymore, but you still get a lot of local people that will follow you. And there are some fun ways to build up your following in that way. But you gotta do it, and you gotta do it full force.
Okay, so let me wrap this up. Staffing. Now, I know that we usually tell our clients to have social media policies within the office, and we prefer not to allow to have the staff have their individual social media reflecting the practice, that we always like to have it connected to the practice. Could you share your opinion to that?
Yeah, I mean, so the way we do it is that whenever we're showing something on Instagram or Snapchat, since we do use that in our practice, we will promote a blog post we did that day. And then, so they'll watch that blog post, so we kind of get them back to our website. We allow them to go back to our website to check pricing, and then we can find out who these followers are, because there's only so much you can do with all of these like nebulous social media handles. You don't know who they are. So we always are trying to get them back to our website somehow, either to enter their contact information to get pricing or something like that, or to follow up to get our email newsletter. So we're always trying to find out who these people are. And just so people understand how pivotal this has been from our practice, in 2018, our number one referral source was 30% from other patients. The second referral source, 29%, just 1% less, was social media. Already in 2019, all of our referrals, 38% are coming from social media.
You never know where the age of social media is going to go. Who knew this several years back?
Exactly.
Dr. Jonathan Kaplan, thank you so much. It's always great to have a friend and a colleague be with. Thanks so much.
Thank you.
It's my pleasure. Okay, that was Dr. Jonathan Kaplan speaking on social media. Now, we're going to go and we're going to have Dr. Sunil Chilukuri, and he's going to be interviewing Dr. Ed Zimmerman.
Hi, I'm Sunil Chilukuri, Refresh Dermatology, Houston, Texas, but coming to you live from the Aesthetic Show. And I have the pleasure of speaking with Dr. Ed Zimmerman. You're a local native out of Las Vegas, so I know there's a lot that goes on in Vegas, and we say sex sells here for sure.
Absolutely.
Right? And I understand that we're going to be talking a little bit more about women's and men's sexual health and what we can do to continue staying healthy as we continue to mature. Does that sound fair?
It's Vegas, baby.
It's Vegas.
So it's all about, like Sunil says, sex sells. So Aesthetic Revolution, our practice, is where we deal not only in individual male and female, but couples therapy.
Perfect.
What does that involve? Well, after a person is optimized as far as their hormones, bioidentical hormones, then we talk about all the things we have to integrate for male and female sexual rejuvenation. We don't want to just turn back the clock, we want to keep it back.
Right.
So it's not a matter of just bringing them up to speed and then doing maintenance, it's bringing them up to speed and then doing continual enhancement.
Love it.
So better sex, better life.
Wonderful.
We start with things as simple as PRP, O shots,
Okay.
P shots, using platelet-rich plasma in specific areas to enrich the area, better engorgement,
Okay.
better vascular, better sensation, better lubrication, all those things.
Perfect.
Then we add our technologies. Our technologies can include things like Emcella, electromagnetic supramaximal pulses of the pelvic floor for
Right.
both men and women. So for women, it stops all the different kinds of incontinence. It helps with incontinence in men as well. But if a man needs help with ejaculation, prostate squeezing, Emcella is a great technology for him. So that's kind of cool.
Very, very neat.
Along with our PRP, we use pumps for men. We use shockwave therapy for both men and women to knock out the little blockages in the areas that engorge. We use fillers. So every filler that we use in the face, we can use down below as well.
Excellent.
Kind of cool.
Very cool.
What other technology? Oh yeah, lasers and radio frequency.
exactly.
So both superficial monopolar and bipolar radio frequency, so we can clean the area up, make it tighten. We can use liposculpting to reveal the area.
Love it.
Nobody likes a fluffy muffy,
Right.
either male or female, so we can bring that down.
Brilliant.
And we can take that fat and we can put it where it needs to be, either in the labia majora or in the shaft of the penis to get
Excellent.
girth.
So I've got a question. So we're talking a lot more about the millennials. We're talking about what we should be doing for preventative medicine these days. Do you notice that there's a certain age group that you'd say, hey, you know what, my first visit with you should be in your 20s or your 30s or before you have children or after you have children? Is there a certain age group that you'd recommend doing preventative rather than coming in behind the 8 ball?
You know, we certainly see that with our 30-somethings because they're saying sex isn't as good now as it was when I was a teenager.
Interesting.
There's enough of a difference that they come in and they want better ejaculations, more sensation, better orgasm so that we can offer them everything from O shots and P shots to G shots and G shots and Z shots.
Wow, okay.
So we're using filler there. So yeah, I think there is a preventative maintenance to it. And then there are other things that we can do, but basically if we get them hormonally optimized, that's the first order of business.
Perfect.
We have to treat the inside to make sure the outside works well.
Makes sense.
Yeah.
Makes
And
sense.
part of the sexual rejuvenation, it goes from nose to toes.
Right.
We're dealing with hair,
Yeah.
because when people meet you,
Correct.
they look at your hair, they look at how wide your eyes are, they look at your lips. There's an estrogen effect that shows that the lips are more luscious, more
Correct.
sensuous. That's an estrogen effect. Male chest, female chest. Do you have droopers?
Mm-hmm.
Can you bring them up? And then all the way down. Laser hair removal. Can you
Right.
give a kempt appearance
Right.
to everybody? It's all part of the sexual rejuvenation process.
Makes sense.
It's all connected.
I love it. And it's interesting. You know, in the past, we used to frown upon talking about sex and talking about this rejuvenative process. And now it's really out there in social media. We're seeing it all over. I say everybody's Instagram famous these days. And if you're not gramming, apparently we're behind the times. So in our practice, really, I guess it was about 10 or 11 years ago, we were using HA or hyaluronic acid fillers to recreate that vaginal vault and to give the proper friction that's inside there. And I remember being laughed off stage when I described this process, but it changed lives,
Yep.
right? And now you're talking about doing even more naturally, where you're taking the PRP, you're taking the blood, you're spinning it down, you're getting that platelet-rich concentrate and putting it back in.
Correct.
Do you see a
And
change?
fat.
And fat. I
And
love it.
If you isolate from fat the rejuvenative cells, you can put a concentrated bolus of rejuvenative cells into the sexual areas.
Love it.
That helps too.
I love it. Do you notice any difference in the fat between, let's say, the mons pubis or the abdomen? And if we're going to take that down, we're going to spin it down, is it more concentrated, less concentrated? Is it more healthy to put in the face or the lips? Is there any difference there?
The fat in the mons pubis, both male and female, tends to be a little more fibrous.
Okay.
So it's a little more challenging to get that fat to put it in as a fat graft.
Got it.
We have to prepare it a little more carefully, but totally doable.
Very interesting.
Yeah.
Very, very interesting. What else in Vegas? Because you guys often on the West Coast, you're bringing things and it marches across to the East Coast, and I'm kind of stuck in between. I'm in Houston, Texas, and we used to be conservative, but now we're getting there. So what's coming from the West?
I think we're bundling technologies more and more, and we're starting to bundle things at a more cellular level.
Love it.
So not only are we doing PRP and variations of fat, but we're using the umbilical preparations and the things that have more, not really stem cells because there aren't cellular components to this, but it has all the activators, the growers, the healers, the decrease of bad inflammation, increase of good inflammation. Those are all things we can bundle together with our PRP.
I love it.
That comes to us from a supplier and can be used in any human being.
I love it.
So autologous, homologous is probably the best, but this is the next best and it can be purchased off the shelf.
That's great. Advantages. What's the advantage of bringing something off the shelf? You and I, we talk about it all the time, that it's sometimes safer for the patient, there's no anesthesia time, but for the audience that's out there, what would you describe to them saying, hey, this is why I would choose this versus homologous versus something that's from the outside?
Good point. So obviously, like you said, if it's from them, that's probably the ideal, unless they have an underlying illness. If there's something holding them back, the off-the-shelf may be a better choice. There's no procedure involved in bringing the off-the-shelf components in. So say you want a long-lasting filler and you can use a polymethyl methacrylate scaffolding to build volume.
Right.
That's something they can have. You can dilute it off-label into a liter of saline,
Right.
and you can have what we call the Bella bundled bud.
Right.
That's going to come across.
Right.
So we're using not just Sculptra, not just Radiesse, great activators both, but we're using Bellafill as a great activator diluted, and we're applying our M-Sculpt platform to get super maximal contractions of the tush and building tush both ways. Because what if somebody doesn't have fat and they can't afford to spend thousands of dollars on a filler that lasts maybe a year?
Right.
We have something in the United States that's FDA approved to use off-label that we can bundle together
Sure.
to get them that shape
Right.
that they wanted.
Right. Well, and I think it's interesting for those of you guys who are at home, it's really interesting to listen to Dr. Zimmerman and talk about what has changed. So we're talking a lot more about bundling, and we're talking about how you're describing using your collagen stimulator, your PMMA, your polymethyl methacrylate, along with a technology-based type thing that's going to lift up the muscle or bring it up. And if you haven't seen his website, you have to see this before and after. It's a lovely young lady who's laying flat, and it looks like she had fat injections in the buttock, but the big difference is in 2 years, it's not going to look crinkled and like a cottage cheese. It's going to stay looking like that because you've actually used her own fibroblasts to build that up and lift it back up.
Correct. Yeah.
That's amazing.
So it's using these current technologies out of the box in a different way of thinking about them. We're using them as activators, not fillers.
I love it.
And they can be continual activators for a long period of time. So
I love
kind of
it.
cool.
I love it. So as we close out, I want to ask one question because again, a lot of things, they come from the West and come towards us in Houston, Texas. Are you noticing that more men are coming in at an earlier stage, later stage, or is it the same percentage of men that is inside your practice?
We're seeing more and more men. Now, interestingly enough, they're often being brought in by their spouse
Interesting.
or significant other.
Yeah.
So it's great for them to do that. And we teach them about things. We use them in courses. In fact,
Right.
we have a course coming up. Can we talk about that
That's
for
right,
a sec?
please. I think it's coming
Okay.
up in 2 weekends or 3 weekends from now.
Yep. So we have a little course.
Perfect.
This is the Las Vegas Vampire Summit or workshop. We're going to talk about all the vampire
Love it.
procedures that we do nose to toes. We'd love to see you there. So you can
Love
find
it.
out more about that on our social media.
I love it. Well, thank you so much for joining us. Ed, it's always a pleasure. I always get to learn more, and I'm hoping to come to see him as a patient eventually. So with that, we're going to
Thanks for
sign
being an
off.
innovator.
Hey,
We
it's a
appreciate you,
pleasure.
man.
I'm coming
You're an
back to you.
inspiration.
No, you're so kind. I tell you, we always learn from each other, and that's the
We
best
do.
part about these meetings.
Yep.
And that's my favorite part about the Aesthetic Show is really seeing what's coming out and what's being innovative. I'm Sunil Chilakuri sitting with Dr. Ed Zimmerman out of Las Vegas, and we're coming to you live from the Aesthetic Show. Thanks so
Come
much.
Teach us.
Yes, please.
Good morning and welcome back. I have the honor and the pleasure of interviewing Dr. Anil Rajani, or I'll say the Dr. Anil Rajani from Portland, Oregon, Rajani MD. I've had the pleasure of working with Dr. Rajani for many, many years in multiple faculties. Dr. Rajani, thank you so much for taking time out of your busy day.
Thank you.
I know that you are the go-to guy for dermal fillers, neuromodulators, and skincare. So if you will, share with me when it comes time to picking and choosing all of these different devices and skincare, how do you choose on which dermal filler? Because I know you're a national trainer.
Yes.
I don't want to mention any specific names, but how do you determine what the best filler for your patient is?
Yeah, you know, I think that's a very interesting question, and it's one of the main reasons why we do a lot of training over the country and around the world, because we're always learning of different properties of these products as we go along, and hopefully we never find any surprises with the products, but it's really the experience with the products. And one of the things that's often hard to teach is each face is different, and the skin texture and the tone and the needs and the amount of lift, and all of these properties are like tools in our toolbox to create the end result. So it's based on experience, it's based on learning from the key opinion leaders and conferences just like this, where we're really sharing that information. But it's one of the challenges with more and more products coming to market.
So that brings up another very interesting point. I remember many years ago when I first got into this industry, there was one major neuromodulator. There was one major dermal filler. And then one company entered the market and they brought on another couple of products, and they brought on 2 of the hyaluronic HA products, and then 3, and then another major manufacturer came in and another one became FDA approved for a different part of the face, right?
Yes.
And now there's another one entering the market with one right on its tail.
Yes.
When you are very comfortable with one already, and a new one comes out, whether it's on a jet trial, how do you determine whether or not it's something that you want to go to?
I think each practice is a little bit different, and each practice will evaluate what they're doing, what are the tools in the toolbox that they have, but everyone likes something new, meaning the public and inquisitive injectors or providers. And so those who are inquisitive, they want to try it and see what are the slight differences, the nuance, the time of onset, maybe a little difference in duration. For some clinics, that might be overwhelming to incorporate into their practice, and these are some of the challenges that we have. And then if you look at rewards programs, you don't want to dilute. It's very hard to offer all of the products. So which ones work for you? Coming to conferences like this, doing the trainings, and a little bit of personal experience often can help answer that question.
You know what I found is, like, when you work with a lot of vendors and they offer different rewards programs, sometimes it benefits you as the surgeon, the cosmetic surgeon, to offer one product over another because you may get different perks and things like that. However, you know, this is a different world today with social media and TV market advertising. And a patient, many times, how often does it happen to you that they come in telling you what they want? Not only do they tell you what they want, but they tell you how many units they want where.
You know, Jay, it's very interesting. I find it's country specific too, because I travel around the world and train in different countries. In some countries, the patient will walk in and sit there, and the physician will just tell them what to do. Here's what we're going to do. They talk very little to the patient. They come back trusting that the provider knows what to do more than the patient. Now with social media, with YouTube, with Instagram, and all the educational platforms online, the public has so much information, and now you see people injecting themselves and learning that online. So it's really, this is uncharted territory, but not unprecedented from other countries. So we're learning with all this, but there's no question. Social media has played a big role, and the products are largely available.
Right.
Sometimes it's just about anyone. So it's scary, it's fun, and we're learning how to deal with it, but it's tough.
Right. I know that you've become an expert in the skincare market. In our final wrap up, can you share with me what is your go-to and your takeaway from skincare products and how you represent it and present it to your patient?
Topical skincare? Yeah. I think there are the staple products, the fresh vitamin C's, the retin-A's, time proven, and then you start to get on the fringe of peptides and newer products that we're still learning about. Delivery systems is a very interesting one. How do we get these products deeper into the dermal layers where they can actually work better? So I stick with the basic proven scientific products that work, that we know they're going to produce a great result. When that doesn't work and we need to deviate, then I go to the newer products, the peptides, the snake venom products to see what, and our patients are using this anyway, and they want all this new stuff. They give us the feedback of what they see. But I'm a bread and butter, start them there, and then branch out as we need.
Wonderful. Dr. Anil Rajani, it is always wonderful as a friend and a colleague to speak with you and learn something new all the time. We go back a long way. It's a pleasure.
I appreciate your time.
It
Thanks
is
for
my
having
pleasure.
me.
Thank you so much. Okay, it is my pleasure introducing, that was Dr. Anil Rajani from Portland, Oregon, speaking on the non-surgical and skincare. It's now my pleasure to introduce Dr. Lara Devgan. Dr. Devgan is the CEO of Dr. Devgan Scientific Beauty. Dr. Devgan, hi, it's a pleasure.
It's so nice to be here.
What brings you to the aesthetic show today?
Well, I was speaking in the keynote on generational aesthetics, and as a board certified plastic surgeon and the chief medical officer of Real Self, this industry pertains to me a lot.
So we're going to speak about the introduction and advances in facelift and surgical and non-surgical approaches. Everybody has a different opinion. So as a board certified plastic surgeon, how do you make the differentiation? I know it's not, it's a lot easier on the surgical side because you're the go-to person as the surgeon. But on the non-surgical side, you could have mid-level providers and ancillary providers that are under your direction handling that. So why don't we speak about how you make that decision on behalf of your patient?
So I think the key thing is understanding a patient's unique anatomic characteristics and their goals and expectations for a procedure. And if you do that, then you're golden. The nice thing about where we are in 2019 is it's really a continuum between fillers and facelift. And we have these minimally invasive, non-invasive modalities for younger patients with less laxity, with fewer concerns. And we have the major surgery for patients where the concerns are more major. And the way I kind of look at it is the way cardiology has transformed our approach to cardiac surgery. There are still patients who have a heart attack and need a bypass surgery and get their chest cracked open once they head to the ER. But if you have a heart attack today, there's a good chance that you're going to be able to emerge from the hospital a day later with a little groin incision and a stent. And that's kind of what injectables have done for not everybody, but for a large percentage of the population.
Injectables help, all right? It gives you a more immediate refreshed look, but sometimes you're going to need more injectables and more injectables as maintenance.
You get the puffy filler
All
face.
right? Well, not even like that, but I've got the event. I can't get a facelift because I've got a reunion or a wedding. I need the fillers, okay? And some of them are longer term. How do you determine whether or not you want the shorter term, the longer term, or the traditional facelift?
I think part of that is understanding the patient's expectations and their time frame. One key rule of thumb is understanding that if you have more than a centimeter of pinchable laxity in the mid-face, the jowl, or the neck, you're going to graduate from what injectable fillers are capable of. And there is this tendency in our industry, and I'm sure you would agree with this, sometimes people think that more and more filler is going to add up to more and more of a result.
Correct.
But the truth is, it's kind of like a pencil and a pen. If you press harder with a pencil, you'll get a darker line, but it is not going to become a pen. It's just a different category of result. So at a certain point, you do need to call a spade and say, you know, you've got this pinchable laxity, you have malar descent, you have platysmal banding, submental fullness, jowls, you have these stigmata of facial aging that are really going to be best addressed surgically.
And some of these fillers now that are talking about fat reduction in the submental area and under the chin are trying to take the place of traditional surgery. And really, your opinion on, does anything really take the place of surgery?
Surgery is the most invasive result and also the most aggressive result, and you're going to get the biggest correction and the biggest bang for your buck. On some level, even though a facelift is a very expensive operation, it's still the most value proposition operation or procedure you could have. That being said, I actually am a huge believer in the power of injectables, and I think that you can get a very beautiful and transformative result when they're done right if you manage someone's expectations properly. But deoxycholic acid to dissolve submental fat, We can use high G' fillers to create a cheekbone sculpting, jawline sculpting, and there are procedures today that really were not possible a decade ago, like non-surgical rhinoplasty, tear trough augmentation.
Right.
You can create a little bit of the feeling of a medicalized, three-dimensional type of makeup.
More is not always better, right?
No, more is not always better. It's like, I sometimes think of it as the pizza rule. Like, it's okay to throw a little bit away. You don't need to just throw a lot of product in someone.
Eat until you're no longer hungry, not until you're full. right?
Exactly.
Okay, Dr. Laura Debkin, thank you so much.
Thank
It's been a
you.
pleasure having you today.
So much
I really
fun.
appreciate it. Thank you so much.
Of course.
Okay, well, that's going to be a wrap for this morning, and we will having more live interviews later today, a little earlier this afternoon. Thank you all for taking time out of your busy morning for being part of Aesthetic Show Live. Thank you so much. Jay Shore signing off now. Thank you.